welcome back to my channel. Today I would like to share with you a reflection on some of the new systems that have been introduced into our healthcare service. Notably, I've been thinking about a new AI tool that has been rolled out as a cohort categorization system. This system looks at patient records in primary care to assess a patient's risk of hospitalization over the next 12 months. It's called the Brave AI tool. I believe it's been designed in such a way to identify patients who have accumulated health conditions that put them at high risk of hospitalization. It's been said to use machine learning. It analyzes multiple factors like frequency of consultations, which is a marker of high healthcare need. It also looks at previous admissions and other parameters. So from this, it then generates a probability score ranging from 0 to 100. Now, it said that this tool will introduce another way of risk stratifying our patient population in primary care, and it has already been rolled out across most primary care networks in the Southwest, and it is now being introduced into my own PCN, where we are setting up our Frailty service. Now, I mention Frailty here because interpreting the Brave AI score, I would assume, would require a bit more nuance. Frailty, in the technical sense, has a close relationship with aging and the loss of physiological reserve, which makes a person more vulnerable to minor stressors and rapid deterioration. By contrast, Brave AI considers all patients regardless of age. I think this is quite helpful because it's going to be broadening our view beyond just older people, because we'll be looking at vulnerability across board, including younger persons, and potentially will help us not to miss those very vulnerable patients in our population. Typically, we do not describe people who are under 65 as frail, but Brave AI, I believe, is going to allow us to look beyond that threshold. Now, this excites me because we now have two complementary clinical parameters: one, risk of hospitalization, and frailty, to shape how we interact with patients and to help us build a more proactive care model. These parameters, I believe, should guide us towards establishing a true need-based care, which lies at the heart of the NHS. But of course, just a scoring system is not enough. We still need to perform all the necessary clinical activities for frailty, including comprehensive geriatric assessments, recognition of management of frailty syndromes like delirium, immobility, medication sensitivity, polypharmacy, and incontinence. These are still essential, but the Brave AI tool, I believe, is going to be adding an extra layer of clinical decision support, helping us to identify patient cohorts who may benefit from our multidisciplinary team review in primary care. To take this a step further, I think this is going to be aligning very neatly with the current policy drive to develop the neighborhood health systems that's going to be supported by new forms of contract expected in 2026. And the vision here is to redesign NHS services around patients in their local communities, emphasizing mainly preventative and proactive approaches rather than purely reactive care that is currently the norm. But for now, the primary care networks are the ones facilitating collaboration between practices and to deliver much of the joined up care or the cohort-based care that this type of tool will be much more useful. So, but my hope is that we can refine the processes so that they are practical for day-to-day clinicians, making it simple to apply both the BRAVE-AI and the frailty assessments meaningfully for everyday individual patients. I hope you found this presentation helpful, and let me know what your thoughts are about the BRAVE-AI tool if you use it in your setting. I'll see you in the next one. Bye for now.